It's really that three-legged stool of contact tracing, testing, and public health orders that together work to help us control the virus. And you know, our medical health officers and clinical teams work very closely with Dr. Shahab's team around looking at what the current restrictions are delivering with respect to what we're seeing in COVID. You know, we see cases in a different way than we did before. That, you know, we're seeing large scale community-based transmission, and that's a much more complex problem for us, and including it's a much more complex problem to actually contain with a single public health order or a single rule. It's not one thing. It's a series of multiple components that are going to help us get there, and we've done it. We did it at the beginning of this, and we know how to do it. We've got lessons learned. We know more things about the virus with respect to how it's treated. We know more things about some of the successes around how we distribute work across the organization. But the reality is that if we don't work those three legs, you know, we can have all the resources, you know, in testing and contact tracing that we would ever wish for, work towards 300, 400, 500 cases a day, and it will be for naught, because if we don't have people who are moving the virus around the province stopping to do that, we simply will not be successful.
It's just imperative that we all work together for the same goal. COVID is everywhere. COVID is job one for us in the healthcare system, and it has to be job number one for every single person. I can tell you it's so frustrating when I get emails, I get letters, I get phone calls, I get texts, I get tweets by people saying this isn't real, you're exaggerating, it's not really happening, why are you doing this to us? I just have to say it is so real. I cannot tell you enough how real this is. And we need everybody to see this as job number one.